The reason why I want to talk about Pitocin is because I was going back listening to some of the womb wellness calls that we did back in 2016, I believe. And there was a doula on there who was talking about how Pitocin affects your heart. So that basically opened up a can of worms, and all these worms came out, all these nasty things, all of these truths. I began to learn about Pitocin, and I wanted to share them with the public. So we will be talking about Pitocin, oxytocin, side effects on mom and baby, the dosages of Pitocin that you should be given if you are going to get Pitocin. Why is it being used so much? And does it cause autism? We will be talking about all of that. I'm going to be giving you the information that's not from me. I will share my personal experience of when my side effect that I had from getting Pitocin. So we know that anything that you take does have a side effect, good or bad. There's a side effect to it. Now, Pitocin is supposed to mimic a natural hormone, oxytocin. So Pitocin is a hormone that is used to induce labor or strengthen uterine contractions or to control bleeding after childbirth. Pitocin is also used to stimulate uterine contractions in a woman with an incomplete or threatened miscarriage. So even if you're not going into like giving birth, well, really a miscarriage is still giving birth. It's just to a baby who is not going to make it or who has already transitioned. Pitocin may also be used for purposes not listed on this medication guide. So this is a link that I have from Pitocin uses, side effects, and warnings. So some of the side effects of Pitocin is a fast, slow, or uneven heart rate, excessive bleeding long after childbirth, severe headache, blurred vision, pounding in your neck or ears, or confusion, severe weakness, feeling unsteady, slow heartbeats or abnormal heart rate. These are the side effects to the newborn baby. Jaundice, a yellow appearance of the baby's skin, which is considered to be jaundice, a seizure, eye problems, or problems with breathing, muscle tone, and other signs of health problems. You could also get nausea, vomiting, more intense or more frequent contractions. There's a number here where you can call the FDA if you have any of these side effects. 1-800-FDA 1088. This is interesting as well. And I don't know if a lot of medical professionals really think about this, but I'm sure they have another medication that they can give you besides this one. But if you have a severe infection in your uterus, you should not be treated with Pitocin. A difficult labor because you have a small pelvis, genital herpes, cervical cancer, surgery on your cervix or uterus, including a prior C-section, high blood pressure, or heart problems. If you have any of these, you should not be getting Pitocin. So Pitocin, like I said, is a synthetic version of the natural hormone oxytocin. Now, this is where I want to get into how we can try to prevent even having to get this. But you know that when you go into the hospital, it's like procedure that you're going to get on Pitocin. The contractions are going to come stronger, more intense, that you'll be screaming for epidural. Some people thug it out and they don't get an epidural. But when you get that Pitocin, because it's so unnatural, it's forcing your body to go into labor. Is basically is inducing you. It's trying to force your body to go into labor when your body and your baby is not ready. So anytime you're trying to force something, there's going to be some issues with you trying to force something. So it's usually you get the Pitocin. These are the cascade of events. You get the Pitocin, screaming for epidural. Sometimes you get the membrane sweep, they're breaking your waters, doing all this stuff. And for those doctors who don't want to wait on labor, or the ones who want to, they don't want to wait on labor, they want to go ahead and get it over with, you're going to get a C-section, okay? That is the way that it goes. So Pitocin is mimicking the natural hormone oxytocin. And oxytocin is a natural hormone that manages key aspects of the female and male reproductive systems, including labor and delivery and lactation, as well as aspects of human behavior. Your hypothalamus makes oxytocin, but your posterior pituitary gland stores and releases it into your bloodstream. Hormones are chemicals that coordinate different functions in your body by carrying messages through your blood to your organs, muscles, and other tissues. These signals tell your body what to do and when to do it. Your hypothalamus is the part of your brain that controls functions like blood pressure, heart rate, body temperature, and digestion. Your pituitary gland is a small, pea-sized endocrine gland located at the base of your brain below your hypothalamus. Healthcare providers use synthetic forms of oxytocin like syntocinon and Pitocin to induce labor. So it's like if you can't take one, they'll probably give you the other one. And they use this to induce your labor and childbirth if it hasn't started naturally, or to strengthen contractions. Healthcare providers also use synthetic oxytocin to speed up delivery of the placenta, the third stage of labor, and reduce the risk of heavy bleeding, postpartum hemorrhage. The two main physical functions of oxytocin are to stimulate uterine contractions in labor and childbirth, and to stimulate contractions of breast tissue to aid in lactation after childbirth. Oxytocin also acts as a chemical messenger in your brain and has an important role in many human behaviors and social interactions, including sexual arousal, recognition, trust, romantic attachment, parent-infant bonding. During labor, when the fetus body's usually head pushes against your cervix, the nerve impulses from the stimulation travel to your brain and stimulate your pituitary gland to release oxytocin into your bloodstream. The oxytocin travels to your uterus and stimulates contractions. Okay, there's more information I'm not going to read here, but we will talk about oxytocin and lactation. Once your baby is born, oxytocin promotes lactation by causing contractions of the myoepithelial cells in the alveolar ducts of your breast. These contractions move milk through your breast tissue. When your baby sucks at your breast, oxytocin secretion causes the milk to release so your baby can feed. As long as your baby keeps sucking, your pituitary gland continues releases oxytocin. Once your baby stops feeding, the release of oxytocin stops until the next feeding. Why is oxytocin called the love drug? As oxytocin is associated with trust, sexual arousal, and relationship building, it's sometimes referred to as the love hormone or cuddle chemical. Oxytocin levels also increase when you're hugging someone and when you're experiencing an orgasm. So, doulas, birth workers, even like people who are going to support a pregnant mom, a person who was about to give birth, you want to encourage affection, basically, like hugs, kissing, spending times with families, friends, people that they actually love, people that they actually care about. And you want to make sure that the pregnant mom is participating in stress relieving activities, things that make you feel good, things that are relaxing. So I often talk about how we do all these plans for the big day when we should be really focusing on the postpartum period that lasts for years. But we're going to go back and focus on actually preparing. While that's why it's good, don't birth without a doula. That's why it's good to get a doula, but you also need to get a doula who was educated on stuff like this. And birth workers, if you need continuing education, I have a womb mentorship program, um, birth workers continuing education, where we do these classes for free every month, and you get to get advice and stuff like that. I've been a doula for over 15 years, so I've seen a couple of things. And it's so important to prepare your body for labor. Not only you're preparing your body for labor, but you're also preparing your body for the postpartum recovery. So if your labor isn't all that difficult, you can count on your postpartum period being a lot gentler or easier than if you have a complicated or a traumatic, or I mean like extremely traumatic birth experiences. And receiving oxytocin, it can be extremely traumatic for some people. So those who are birthing, you want to make sure that you are not in stressful situations. So you're supposed to keep a pregnant woman happy, keep them fed, rested, and no stress, because all of that you've gone through even before you get pregnant is going to show up in the labor. It's going to show up. If you have been working on yourself, it's going to show up. If you have been ignoring red flags and being a people pleaser, it's going to show up as well. So you want to make sure that you are zoned in, focused in on your pregnancy, on healing your body, on bringing your baby into this world under the best circumstances as possible, because these are the things that causes blockages and delays, and you start having stalled labors because there's something going on within your emotional body. It may not be anything physical, but it could be some mental stuff. It could be some traumas that we have not addressed. So it's extremely important for that. And I did write about preparing for labor in my book, The Dark One Redemption 2, which is a guide to childbirth and postpartum. So you want to make sure you're hugging your clients, you're hugging your friends. I mean, pregnant mom, you're hugging your friends, the people that mean something to you, even your other children. You want to be getting a lot of love to be releasing that oxytocin, because we don't want to have complications even with breastfeeding, because some people feel like, and really some of the trauma that could be caused from sexual abuse from when you were a child. It could be caused from sexual assault as an adult. It could be abandonment issues, a separation, a divorce, homelessness, losing your job. There's so many things that can cause stress, but you want to make sure you create a stress-less, stress-free environment, a calm and relaxing environment, so that you can go into labor and your body and your baby can work together and bring your baby here without the need or the desire for wanting any outside medications like oxytocin and epidural. So does oxytocin affect the also how does oxytocin affect the brain? Oxytocin plays an undeniable important role in establishing and maintaining relationships. And it all begins in one place, the brain. Once oxytocin is produced by the hypothalamus, a portion of the brain that keeps the body's internal function in place, it's secreted into the bloodstream by the pituitary gland. From there, oxytocin is directed into the spinal cord. Okay, this is cord. This is basically, I think I read this before. Oxytocin has the power to regulate our emotional responses and pro-social behaviors, including trust, empathy, gazing, positive memories, processing of bond cues, and positive communication. Thanks to oxytocin, we get a toasty, tranquil feeling whenever we're with the people we care about. And the more we engage in those feel good behaviors, the more oxytocins we get. You might even call it addictive. Oxytocin is also connected to serotonin and dopamine. The trio of neurotransmitters is often referred to as the happy hormones, and for good reason. Under the right conditions, they work as a team to make us feel butterflies. Whenever we're with someone who we're attracted to or care about, our brain releases dopamine. Serotonin levels increase, oxytocin is produced, and presto, you get the buzz that love songs are written about. Oxytocin contributes to the parent-child bond. So this goes with while you're in that prenatal stage, perinatal stage, before you give birth, you want to make sure you're being around the people you love, your family, your friends, doing the things that you love, because we don't want, like how we hear people say, I didn't bond with my baby. It's could be from a lack of oxytocin. So mothers with high levels of oxytocin are more likely to be affectionate with their children, frequently checking in, touching, feeding, singing, speaking, grooming, and bathing their babies. In turn, the children receive a boost of oxytocin and learn to seek out more contact. A similar effect has been found in adoptive parents. Oxytocin is even thought to impact fidelity by some experts. Researchers believe that oxytocin's influence on reward pathways create a positive behavior loop for engaging in social and sexual contact with a reliable monogamous partner. For the most part, releasing oxytocin requires one thing: another person. While it's traditionally associated with sex, breastfeeding, and childbirth, almost any form of social bonding or positive physical contact can trigger oxytocin. One study on chimpanzees even found that sharing a meal does the trick. Common triggers include positive physical contact like cuddling, kissing, hugging, holding hands, social bonding, talking, making eye contact, laughing, sex, breastfeeding, childbirth. So I was talking about the medical. I'm talking about the medical intervention. Again, it usually go like the membrane sweep, Pitocin, you're breaking your water, and then you want the epidural, and then voila, you get the cesarean. That's usually how it goes in the hospital. Some people can still get Pitocin and not get an epidural, not get a cesarean or Pitocin, and that's it. But it's considered to be a vaginal birth, not a natural birth. A natural birth means that it's medicated free, no medicine. So the Dark Womb Redemption 2 is a guide to pregnancy, childbirth, and postpartum that you can get that talks about mate selection, family planning, childbirth preparation, creating a birth plan, creating a postpartum plan, talks about belly bonding, V-steaming, nutritional plans, and all that stuff. That is available on craftswoman.com. That's the Dark Womb Redemption 2. So you can go ahead and look that up. For more information, if you are expecting, also if you are in a birth worker and you are dealing with people who are giving birth and families who are giving birth or who have already given birth. So this is another link that is called The Truth About Pitocin and When It's Worth the Risk. It can increase your risk of postpartum depression and anxiety. Mamas with a history of depression and or anxiety who received Pitocin during labor had a 36% increased risk of developing postpartum depression and anxiety. Even mamas without a previous history of depression and anxiety still had a 32% increased risk. longer labor. Remember, I was saying that because you're forcing the body to do something that it's not ready to do, you're fighting against the body, you're fighting against nature, you're fighting against what is supposed to naturally be. Sometimes people may stay in different stages of labor longer for so many reasons. It could be blockages in their brain, their mental. Maybe they're afraid to give birth, or, fears. Maybe the person who they want to be there is not there. Maybe the person who is there, they don't want to be there. Like being in a hospital surrounded by strangers, people who you can smell. And when you're pregnant, your senses is very strong. You can smell their perfume, cigarette smoke, stuff like that, that the the nurses and people are coming in there, and that can disrupt your flow, your vibe. um you could all, if you have fibroids, if you have some type of disabilities, different things in the way, that could also make your labor longer and cause you to them to anyway, they can make your labor longer. But you have a higher risk of C-section. One study found that inductions actually doubled the risk of C-section. Remember, Pitocin is a form of induction. There's so many ways to induce. I have used some certain things, but it is nothing like medical. It's some natural stuff like herbs. I am a fan of castor oil. I never had diarrhea, none of that stuff. It did help me. But I know some people are against it. And calafum, which is a homeopathic version of, I believe, blue cohosh herb. So there's so many things that you can take. Red raspberry tea. I have my womb herbs available on my website, cropswoman.com, that you can take while you're pregnant and increase the dosage, because it's the it has red raspberry leaf in it, also along with nettle, which is good for hemorrhaging and iron. So that's a good thing. You can start taking your herbs to help you to not have a stalled labor. You can do exercises. There's so many things that you can do to get your body ready. Not only everybody's about, not everybody, but it's a common theme that, or it's commonly said that you can use dates or eat dates. But I mean, aloe vera, that helps. Okra, that also helps. So you want to eat certain things, drink herbs, water, walking, those things like that can help you to where you don't have to get any type of induction. And remember that due dates are guest dates. Sometimes you just don't know. The sperm can wait on the egg can wait on the sperm. Sometimes them guest dates are wrong. So they're fixing it all on the date when you could have gotten conceived 2 weeks before, 2 weeks prior. So the dates could be wrong. And sometimes babies are not ready, or the body's just not ready. Higher risk of hemorrhage. So the American Academy of Family Physicians considers Pitocin the first and best choice for treating postpartum hemorrhage. Because it has fewer side effects than other medications, but studies indicate postpartum hemorrhage is also a side effect because it can cause uterine rupture. The intense contraction can cause the uterus to tear in a VBAC situation, or even in a uterus without scarring. Uterine rupture is a rare but catastrophic condition that can lead to fetal and maternal death. One healthcare center found that 77% of their patients with uterine rupture were given Pitocin during labor. So that's another thing that we're not talking about. It can rupture your uterus. And then sometimes, yes, you can not be here anymore. You can also have to get a hysterectomy as well. Research suggests that another cause of postpartum hemorrhage is the continuous flow of oxytocin instead of the body's typical post flow. This can make the uterus less sensitive to oxytocin, making it harder for natural oxytocin or even Pitocin to help stimulate the contraction of the uterus after delivery of the placenta. Now, I know that some people are voluntarily getting cesarean, which usually goes with the the induction, Pitocin, epidural, cesarean. But when you look at the maternal unalivings or a lot of times, or the infant, it's not with the home births, which I feel like is so risky. It's not the home births. It's not the birth center births. The mortality rate is high within the hospital with all of the fancy equipment, with the surgeons, with the doctors who have all of this experience and all of this education. And we do know that Black women are top on the list for infant mortality, or Black babies. When it comes to infant mortality, and Black mothers when it comes to maternal mortality. So it might be best to avoid the C-section as much as possible. If it is at all possible, avoid it. There is a such thing as VBAC, vaginal birth after cesarean. It is possible. You also want to make sure that your uterus is strong in order to be like a good candidate. You have to be pretty healthy. You really need to be healthy to birth a child anyway, because you're giving your life literally to bring another life into the world. Pitocin causes stronger contractions. Experts agree a Pitocin labor is different from natural labor. Contractions are much longer, stronger, and closer together than natural contractions. Also, the uterus doesn't get to completely relax in between contractions. When the uterus is contracting so strong for such a long period and with little break in between, babies can suffer from lack of blood flow and oxygen deprivation, causing abnormal fetal heart rate patterns and fetal distress. Yeah, so when you get this stuff, it's automatically the baby's heart rate. Oh, there's D cells, and then they panic. Oh, switch. I remember they telling me switch to the left. I had one medicated hospital birth with. I know I got an epidural, and there was a lot of other stuff given to me. I can't remember because I was asking. I think it was Pitocin. But anyway, I know after I got the epidural, that heart rate started going down. And they was like, turn to the left. And I didn't even need all of that. Like, I was so close to giving birth naturally. Straining for baby. Pitocin can also, this is another side effect, straining for baby. Pitocin can cause some issues for babies. Fetal heart abnormalities, slow heartbeat, arrhythmias, low APGAR scores, neonatal jaundice, retinal hemorrhage, permanent central nervous system or brain damage, fetal death. This is all from Pitocin. Additionally, one study found that babies born after augmentation with Pitocin had almost 3 times greater risk of oxygen deprivation, which can lead to cerebral palsy or brain damage. Labor induced with Pitocin was also linked to higher chances of the baby being admitted to the NICU for longer than 24 hours. People are often like, oh, as long as I get my baby, as long as I get my baby, I'm fine. But you want a healthy baby too. You don't want to be spending time separated from your baby being in NICU, or having to wipe your child's butt forever for the rest of their life, hiring people to take care of your child, them never being independently able to take care of themselves. Yes, we love all babies, even those who are mentally delayed, but nobody wants that. Nobody is getting pregnant to have a baby who is going to be dependent on them forever. So you want to look at these things that they're putting in your IV when you are going into labor. And people want to talk against being natural, but it's like honestly, once you mentally, it don't even be like how you feel. You want to, you of course you definitely want it to not be uncomfortable when you want to hurry up and have a baby, but at some point you get to, this is what I have to go through, and I'm just gonna go through it. Who wants to okay, so you can't smoke and drink while you're pregnant, but you can get drugged the hell up when you having that baby. And it's going directly into your bloodstream. It's not a drink that you're taking, an occasional beer or wine, which we are so against. We're so against cannabis and all these things, but you're actually getting these medications with all of these bad side effects that you can Google yourself, and putting them directly in your bloodstream when your fragile newborn baby is being born, when you are at the most critical point of your life as a mom. Your life is on the line too. It's not only the baby's life is on the line, your life is on the line too. You shedding your blood for a child to come into the world. This is another article that says 15 more Pitocin complications mother needs to know. Now, of course, some of these may be redundant, but painful contractions, we talked about that. Allergic reaction. Some women are allergic to Pitocin, and then you don't even find out because it might be your first time taking it. Emergency treatment may be needed if a mother experiences facial swelling, hives, trouble breathing, and other symptoms of an allergic reaction after Pitocin is being administered. And so the reason why women are accepting Pitocin is because the medical staff is can be intimidating. That's why it's good to have an advocate with you to help give you confidence, or a doula. Don't birth without a doula, as well, to help you to make the best decision. And then the injections as well, more so on the injections, but usually the people who get the Pitocin, they get the injections too. They said there have been studies that have suggested a possible link between the use of Pitocin during labor and an increased risk of autism in children. One study published in 2013 in JAMA Pediatrics found that children who were exposed to Pitocin were more likely to be diagnosed with autism spectrum disorder.